Hello friends, I'm Dr. Rohit Shetty. I represent Narayana Nethralaya as a refractive surgeon. Today I'm going to discuss with you about the flow as soon as you come to our hospital, Narayana Nethralaya, Bangalore. There's always this worry and concern that what really happens in the hospital? What are you going to do with me? What are you going to do with my eyes? So I thought I'll make this small video about the sequence. So as soon as you come into a hospital, you pass the gate, and this gate will have people checking for your COVID. You're doing it for your own safety because we have people coming in. So as we check you and you feel that you are fit, then you go to the reception, you fill in your forms, you fill in your address, and then you come to my floor. Once you come to our floor, there is a person who will talk to you about the reason you come here. Then your refraction gets done. That means we get your right power. And after your refraction is done, there is a process of multiple tests, which I'm very proud of. We are probably one of the only centers in the world, one of the few centers in the world, which does so many tests on an eye to make sure that you are the right candidate if you want to go for the surgery. Why am I saying this? Because if you do one scan and decide on the procedure, you may not be suitable or you may be in the borderline. So I'm taking a risk on that. So we wish to make it very perfect. When I say perfect, we wish to make sure that we don't miss anything. I'm a human being and machine is also not some god. So when we are dealing with all this, we have to be very careful to choose, are you a right candidate to get a procedure done or not? Out of 10, 4 of them are not eligible, and I tell them we can't do it. Of the 6 who are eligible, we decide what kind of procedure can be done. So what are the tests being done? We do a pentacam and topographers to look at the curvature, shape of your cornea. We look at the biomechanics, which looks at how strong your cornea is, because we can see it moving in and out with the air puff. Air puff is nothing but when you sit there, you get a gush of air coming in. So when it hits your cornea, it records the movement of the cornea. It's a very important test which tells me the strength. Then there's something called as epithelial mapping, which looks at how the mapping is. We look at sometimes dry eye, and we also do advanced AI-based metrics. We also look at how the collagen is. And after everything is done, you get a retina check to see how good your retina is. And after this is done, sometimes you may have to put drops and do the check, and sometimes you may not need that because we have machines which can do the whole test without actually putting the drops. After that, you meet one of us and we will discuss with you based on all the scan, are you in for the procedure or you out? And if you're in, then we will discuss with you the entire issues of what LASIK is, what are the risk benefits, what are the risk benefit ratios and everything. And then you move to my counselors, that they will help you again about do's, don'ts of the procedure. After everything is done and you decide to move ahead, we meet the counselors who take care of the insurance, if you have an insurance process. And if after the insurance process, we give the scans and everything to you, and also we provide with the consent form. This is important. The consent form is a document which is traditionally given on the day of surgery, but we believe that consent has to be given the day you meet me, because you have enough time, because it's all about being transparent. Everything has to be transparent. You have to know exactly everything about the procedure. You get enough time to read, note down on that form. And if you feel that there is anything which is bothering you, you can come back again, or on the day of surgery, you can meet us. So what happens? The whole process takes around 2.5 to 3 hours. I'm sorry to keep you waiting for 3 hours or plus, but there are so many things which we need to do. I don't want to do it in a rush. We don't want to rush through anything so that I miss something and say sorry. So 2 to 3 hours or plus is a must in my workup. And after that, you decide on the procedure after everything is convinced. So you come on the day of surgery, you'll be called based on what time we are doing this procedure. Once you come down, on that day, you have your bath, have your normal food. You don't need to come here empty stomach. Be normal, wear your normal dress. Don't use perfumes and makeups on that day of surgery. It's important because perfumes affect the lasers and makeup affects the outcome. And then you come and you may have to spend an hour and a half. Again, we do the test, some of the tests just to document it so that we are repeating it. It's said that more you repeat, you become perfect. When you're repeating, it means that we want to just repeat it so that we are not miss anything. Some things are repeated, and after that, you're shifted to the OT, and then you're called into the OT. And when you come into the OT, we speak to you. We just make you lie down under a light. We put a drape on your eyes. We put anesthetic drops. You see the lights, and must have seen a lot of videos. Videos look scary, my friends, but the surgery is not. And I always tell, best thing is when you see through a cartoonish kind of a videos, it looks like, oh my God, I'm cutting through the cornea, but it doesn't hurt at all. And within 4 to 5 minutes, you're out of the room. And once you go out, my counselors will take you down, explain, and doctor will see you on a slit lamp so that everything is there. Sometimes some lashes, sometimes some small spot of blood gets into the eye, to the cornea or the area where you are cut. So this may need some washing, cleaning, but that's something which we can do it immediately, or sometimes we do it the next day. So sometimes we also put in a contact lens. This is important. Contact lens is called bandage contact lens. We put the bandage contact lens. Sometimes we put for both the eyes, sometimes we may just put for one eye. It depends on the surgeon. If you're a contact lens wearer, the surface is irregular. One eye may have a very regular surface, other eye may not have a regular surface. If it's not a regular surface, we use a contact lens. You are comfortable during the post-operative time. So if I don't put the contact lenses, what happens is you become uncomfortable. You have pain, you have watering. So we don't want that. So we put a lens. Sometimes I put for both the eyes, and that contact lens will be removed the next day morning. None of these things are a complication. Having a lash, having little bit of blood, or contact lens being put, it's just a normal process. Sometimes we put, sometimes we may not. And after that, you go home, you advise drops, take rest for the evening, be a good listener, do not speak too much on that day, don't watch TV, take rest, and next day morning get up, do your brushing, have bath, no head bath for at least a week, and then you don't splash water. Whenever you clean your face for the next 5-6 days, use the water what you drink. Use that, because that's the cleanest form of water. And we give some tissues, other things which you can clean it. And be very careful with your eyes. Use the sunglasses when you go out, just to see that you are protected. And my counselors will explain what drops you need to use for 1 month, 3 months, 6 months, tablets to be taken. Everything will be explained to you. And then I usually see between a month and then 3 months and 6 months. But if you have any issues in this period, you can always walk in, and one of us we work as a team. The whole group is a team. Everybody is a refractive surgeon, and they are all very tuned to this. Everybody has done thousands of surgeries. So it's not that, okay, just one person has to see me. It's just that we all work as a team and everybody does the same thing. So you can trust us on that. And then every yearly follow-ups in between, if you're a high myopes, we have a minus power, make sure that you get your retina checked up once a year, because there may be chances of retinal holes and other things. In between, during the evaluation, which I missed to tell you, that if there is a retinal weakness, which the retina surgeon picks up before surgery, they expect you to give a laser to that. So what happens is, when your eyes are stretched, because you are high myope, this is your retina, when it gets stretched, you call it as a lattice. It's a stretch marks. So when it gets too much stretch, you have something called a hole. So what they do is they use the laser to settle that hole so that it doesn't become a problem later. So this is the flow, what happens in refractive surgery at Narayana Nethralaya. Thank you.